Hello everyone, welcome to ObGyNuggets. In this section, myself Dr. Avir Sarkar, we will be talking about genital tuberculosis. Genital tuberculosis. Genital tuberculosis or genital TB is one of the most common disorder which is seen in women of reproductive age group. So it is very imperative that you know about genital tuberculosis, how to diagnose, what are the modalities, what are some of the MCQs that come in your super specialty examination also. So coming to genital tuberculosis, you should remember genital tuberculosis can be primary as well as secondary. Primary genital tuberculosis is very rare. Almost all the cases of genital tuberculosis are generally secondary. So where are the primary organs? The primary organs lie in number one, lungs. Lungs are the primary in most of the cases, followed by lymph nodes. So most common primary is lung, followed by the lymph node tuberculosis, which comes to the genital organ. Now, what is the route of spread through which it comes? It is the hematogenous route of spread. Hematogenous spread occurs for genital tuberculosis. Okay. So what is the most common site? Most common site are the fallopian tubes. So if this is your uterus, cervix and vagina, so the most common site are the fallopian tubes. So which part of the fallopian tube? The ampulla of the fallopian tube. Ampulla of the fallopian tube is the most common site of affection by the genital tuberculosis. Okay, 90%, more than 90% of the cases of genital tuberculosis affect the tubes, followed by the second most common site is your uterus. Uterus, that is the endometrium. Endometrium is affected by the tuberculosis. Now at this time, I would also want to tell you that you all know this thing, that the tube has four parts, from lateral to medial. It has by the mnemonic of IAS and again I. I stands for infundibulum. These all things you already know. Infundibulum. Then your ampulla. Okay. Then comes isthmus. Isthmus ka S. And then intramural part. Intramural part. Okay. So ampulla is the most common site of salpingitis which occurs due to tuberculosis. Mostly ampulla is also the site for fertilization. Now this salpingitis of tuberculosis can be of three types. It can be either endosalpingitis, where the inner part of the tube is affected first, followed by migration to outside. It can be exosalpingitis, whereby outer part of the tube is first affected, followed by migration to internal. Or it can be interstitial salpingitis, salpingitis. Okay, so most common in genital tuberculosis is your endosalpingitis. Endosalpingitis is more common than exosalpingitis and interstitial salpingitis. Okay. Now, the tubal affection in genital tuberculosis has a specific term called salpingitis isthmica nodosa. Okay. So it is referring to the beaded appearance of the tubes, which are commonly seen in genital tuberculosis. Apart from the beaded appearance, there are other appearances also which we will be talking a bit later in the HSG findings which we get. Okay, so for now remember salpingitis isthmica nodosa is specific for genital tuberculosis. Okay, coming to the uterus, if you find the uterus, okay, then in uterus, what are the clinical features with which patients present? The clinical features, the most common will be bilateral cornual block. Bilateral cornual block. Why bilateral cornual block? Because if you consider this as the uterus, then the part of the uterus which is most affected are your bilateral cornua, because the tubes are almost in 90 to 100% cases. Every time the tubes will be affected, so the intramural part of the tube will also be affected. So the ostia or the cornua are the most common site of affection of the uterus. So bilateral ostial or bilateral tubal proximal tubal block is seen in this thing, genital tuberculosis. Apart from that, the second most common cause will be pyometra. The feature will be pyometra. Pyometra means pus in the uterine cavity. So what is the most common cause of pyometra? Most common cause is, remember, it is senile endometritis, which leads to pyometra formation. Most common cancerous cause of pyometra is, of course, cervical cancer. We all know that. Okay. Most common benign cause of pyometra is, of course, senile endometritis again. But the second most common cause of benign cause of pyometra after senile endometritis is genital tuberculosis. Okay. The third most common feature in the uterus will be your Asherman syndrome. Asherman syndrome. So Asherman syndrome will lead to oligomenorrhea and amenorrhea at times. Asherman syndrome means there is fibrosis in the endometrial cavity, whereby there is absence of, it will lead to no menstrual blood coming out. Okay, so it is a structural obstruction, so that even after progesterone challenge test, or E plus P, that is estrogen progesterone challenge test, the patient does not menstruate. Asherman syndrome. But remember one thing, in early phases of uterine involvement or endometrial involvement, the patient will have menorrhagia, okay, which will then finally, during the later course of time, it will go to oligomenorrhea or amenorrhea, and patient will have absence of menses. So these are the features. Okay. Apart from that, there is infertility. Infertility is found in patients of genital tuberculosis. Infertility can be primary, can be secondary, and most common cause of infertility is affection of the tube, and the endometrium receptivity is hampered. Okay. Apart from that, patients who conceive with endosalpingitis or exosalpingitis, they have chances of ectopic pregnancy also, because the tubal motility is affected. So ectopic pregnancy can also occur in such patients. It is very important at this moment that I tell you two figures. Okay. If you say that out of the infertile patients, how much percentage of the patients in India have tuberculosis? Remember, 17% of the patients have tuberculosis. Whereas out of the tuberculosis patients, 70% are infertile. Okay. So out of the infertile patients, 17% have tuberculosis. Out of the tuberculosis patients, 70% are infertile. So 17 and 70 are the figures that you ought to remember, because it comes in MCQs. Okay. Now, once we have seen all these figures, now how to make the diagnosis of genital tuberculosis. Most common method by which we make a diagnosis is endometrial biopsy. For endometrial biopsy, you have to send for histopathology to look for granuloma. At the same time, you have to send for AFB bacilli, and do a PCR, that is polymerase chain reaction. The most common timing at which endometrial biopsy is done for genital tuberculosis is day 1 or 2 of the cycle, because the os is open at that time and menstrual blood is also coming. Patients who are nulliparous or patients who are unmarried, for them menstrual blood is sent for TB PCR. Menstrual blood is sent for PCR. Okay, polymerase chain reaction. In them, we don't do endometrial biopsy. So this is how we make a diagnosis. Once you have made the diagnosis, what is the treatment that you do? The treatment will be, of course, ATT, anti-tubercular regimen will be given. 6 months to 9 months of ATT is given. But of course, nowadays, it does not depend only upon your biopsy proven case. If you have a very strong suspicion, then you can start ATT on clinical background also, but you have to justify your diagnosis. Okay. Now, HSG or histosalpingography is contraindicated in a patient of full-blown tuberculosis, genital tuberculosis. But if it can be an opportunistic finding that you get an HSG done for infertility and you find the tubal anatomy is distorted, so in that case you can diagnose as a genital tuberculosis also. So the first finding is, I have told, salpingitis ischemica nodosa is beading of the tubes, which can be found The second is it can be a leopard skin. It can be a leopard skin appearance, or it can be a lead pipe appearance. Lead pipe, that is, it is a very narrow and thick tube which can be found, or it can be tobacco pouch appearance. Tobacco pouch appearance. So what actually happens in tobacco pouch appearance? The distal part of the tube has beads like this. It will be a pouch like appearance. So tobacco pouch appearance, golf club appearance. Okay, golf club appearance. So these are some of the appearances, okay, which are found in patients who have undergone HSG for other reason or infertility, and you have found out to have genital tuberculosis. Okay, so these are the important findings which we see in genital tuberculosis. It is very common in India, most common out of the infections. So treatment is also very, patients are much responsive, but once it is Asherman syndrome, it is very difficult to treat. So this is all about genital tuberculosis. I hope you have liked this video, and stay tuned to our OBGY nuggets, whereby we give bits of information in very short period of time. Thank you.